Hey, this is Doc Yates. I'm a naturopathic doctor, registered acupuncturist, and a kinesiologist, owner of the Yates Naturopathic Clinic, and the founder of the interactive health website, Able Health. And this is the Simply Health Podcast, a show for females where I work to simplify and demystify the secrets of achieving optimal health naturally, based on my own experience in working with thousands of female patients over the past 15 years of my clinical practice. Welcome to Simply Health. Hey, this is Doc Yates, and on the Simply Health Podcast today, we are going to discuss some correlations with different conditions that commonly can come up during perimenopause, but you do see them happen at any point throughout someone's life. And we're going to talk about autoimmune conditions. And these are generally inflammatory conditions, and it's a situation where the body is attacking itself. So, for an example, rheumatoid arthritis, lupus, MS, these are all different autoimmune conditions, and the thing that separates them is that it's different tissues and different parts of the body that the body is attacking itself. So for MS, it's attacking the myelin. For rheumatoid, it's attacking the joints. For colitis and Crohn's, it's attacking the intestinal tract and the large intestine. So this is kind of like the rundown of what autoimmune conditions are. But the big thing is that I want to go over is that regardless of the autoimmune condition and regardless of what tissues are being attacked, there is still an underlying element of naturopathic medicine and treatment that is the same throughout. And I guess in all honesty, there is that in conventional medicine, they still almost treat all of these in similar fashions. They give you things to like anti-inflammatories, cortisone, things to reduce the inflammation. And then what they're going to get is immune suppressants, generally starting with methotrexate and then often moving into the biologics. So in all aspects, they're being treated similarly, but I want to discuss the underlying relationship between all these autoimmune conditions from a naturopathic perspective. So, and keep in mind, this is not that you have to do one or the other. Like, I've done cortisone, therefore naturopathic medicine is no longer appropriate for me. Or I'm working on, the diet aspect of naturopathic medicine, therefore I'm never going to try using any medications. The goal in any treatment is to use the treatment that gives the best effect with the least side effects. So if you're doing it naturopathically, and then if you get a flare-up, and if you need to use cortisone to bring that flare back down, that's okay. You still then trying to resume the treatment, assuming you're getting some benefit from it. So I want to go through 6 points that I commonly see overlapping in autoimmune conditions, especially for females. So number 1, top of the list, food sensitivities. In almost any inflammatory condition I see, food sensitivities are involved. And the type of diet that you would want to do, I kind of have people depend on the severity of the condition, because the more food you take away from someone and the more different food types you take away while you're trying to figure out what their sensitivities are, the more restrictive, the less they want to do it. But the worse the condition, the more likely they are to conform and try it. So the top of the line, most restrictive diet when it comes to autoimmune conditions is called the autoimmune paleo diet. And there's not a lot of food that you can eat, but the great thing about it is it's becoming a lot more well known. And therefore, if you go online, there are literally thousands of recipes that you can find online that work for this. So you're not just kind of thrown out there on your own, expected to reinvent everything. Everything is there, which is the great thing about that diet. There's also more straightforward elimination diets that don't necessarily eliminate all the legumes and aspects that diet does. So there are different options, but looking for food sensitivities is important. And I've discussed in a previous podcast, it depends on the condition, but I always like to do it at some sort of elimination diet. And if you're going to do any food sensitivity testing, in my opinion, that should be above and beyond onto an elimination diet, not just to replace it. And if you want to learn more about that, please check one of my previous podcasts on food sensitivities. But food sensitivities, by far, top of the list, always involved. Number 2, Immune reactions to low-grade infections. It's very common to see in autoimmune conditions a situation where the person has had some sort of chronic low-grade infection. Oftentimes they don't even know about it. Oftentimes they're aware of it. Like, for instance, people that have chronic sinus infections or chronic sinus issues or chronic bladder UTIs would be another example. Or say someone who's had chronic, this is a big one, chronic infections in their mouth or infections with root canals that were removed and they got an infected root canal. And especially you'll see it in smaller closed cavities where it's very difficult for the body to treat and deal with this infection on its own. So for each of those, you can figure that out by knowing about the history for the person. And then even for the mouth, just by there was a practitioner I saw, and he used to hold up his finger. He said, "This is my X-ray machine." And he would take it into someone's mouth and he would push in along the gum lines looking for sensitive areas. And if there was an infected root for a tooth, it would be very sensitive for him to press on it. And then at that point, it would warrant him sending them to the dentist to look into that further. And there has been several cases where I have seen where someone had autoimmune conditions, and when they had this infected root canal removed, it went away. So another thing that I've seen actually too, implants that go bad. Like, for instance, breast implants. I've seen those cause a lot of things that were then labeled as autoimmune conditions, which after the implants were removed, then the body was able to heal. And generally it takes 3 to 6 months after that. So immune reactions to any type of low-grade infection within the body will also trigger autoimmune conditions. Number 3, low vitamin D3. So this is correlated with almost any autoimmune condition, someone to have low vitamin D. The thing I've seen though with it is that while that correlation is there, just correcting and giving the person vitamin D isn't enough that it's going to then correct the condition. So it's just one part of it that needs to be addressed, but it is not the the automatic quick fix, instant pill that everyone wants it to be. But it is important as a tool in the case. So correcting low vitamin D is important. For females, a lot of times you will see low progesterone in autoimmune conditions. And this is something I feel that's especially to be aware of with any condition where it's a neurological autoimmune condition, like for instance MS, because progesterone plays a role in protecting the myelin sheath. So it's very important to get your progesterone checked as well. And I know I beat this progesterone drum with almost every podcast, but it's just because I see such a great effect with it. So make sure you get your progesterone checked and balanced with any autoimmune condition that you're working with. Number 5 is just the immune balance in general. So this comes more from a supplement standpoint and things that you do want to do and don't want to do. So what you don't want to do are herbs that just push the immune system in one direction. And the classic example would be a herb called astragalus. So it's great for immune function, but if your immune system is imbalanced, it can push it further out of balance. Whereas immune regulating mushrooms or immune balancing mushrooms, for instance like reishi mushroom, cordyceps mushroom, shiitake mushroom, those are things that you can often get in combinations, and they have an effect to balance the immune function. And this is important. Again, the supplement parts that we're talking about here are only to supplement the actual main treatments. The top 2 things are the sensitivities and the immune reactions to low-grade infections. That is by far the most important things. The supplement parts, like the vitamin D, the progesterone, and the immune mushrooms, these are important, but without addressing those first 2, you won't see the results you want. Point number 6 is that generally in most autoimmune conditions, there is need to improve the body's detoxification pathways. So any of the issues with constipation, anything with liver issues, or anything showing, for instance, liver enzymes being elevated, you always want to make sure that you're doing things to make sure that the body is detoxifying properly, because if it's not, you will see inflammatory conditions will continue to persist. So when I go through the entire list in this way, a lot of times you might think, well, I definitely cannot make all those changes, so therefore I'm just going to take the cortisone, I'm just going to take the methotrexate or the immunologics. And I can totally understand why you would be thinking that. But really, what we're suggesting here is a diet change, and that diet change is not a life sentence. The diet change is for a period of several months until you figure out what are the actual problematic foods. For instance, the AIP diet, maybe you're avoiding like 30 foods. But by the time you figure it out and what foods are actually problematic for you, there might only have to be 5, maybe even 10 foods max, but even rare that I ever see that many. So maybe there's just a small handful of foods that you would have to avoid for a longer period of time. These supplements can be combined, so that there might be 1 or 2 supplements you actually need to take, and then you maybe dive a little bit deeper to see if there is any kind of chronic low-grade infection, and if there is, dealing with that. And that can be as simple as another supplement using some antimicrobial herbs. And I've seen several cases of autoimmune conditions. As long as they're on the antimicrobial herbs, it keeps their symptoms down, and so that they're out of pain. And it just means that we still need to do further work to really get to the end of this problem, to figure out where and how to fully clear the infection. But again, if that's the worst case scenario, that they have to use some antimicrobial herbs and not use immunologics, because while immunologics do work and methotrexate does work, the side effect profile for them is huge. Like, the cancer risk is very significant. So if you can switch to using something natural and get the same benefits while you're actually working with the underlying problem, to me, that's the way to go. But again, that's a decision for you to make. So I hope this was helpful to give a little bit of insight in terms of how we think about autoimmune conditions from a naturopathic perspective. And if you know anyone who's struggling with this, please share this podcast with them. Please subscribe to this podcast to learn more. And remember, Able Health, which brings you this Simply Health podcast, it's all about enabling you to be at your best health so that you can enable others to be at their best health by sharing this information. So this is Doc Yates signing off. Enjoy your day. Thanks for tuning in to Simply Health. If you want to learn more about health, check out Able Health. If you want to see some of the other projects that I've been working on in health, business, music, and life, please check out the links below.